Before finishing today, we would like to pay tribute to Alain Cribier, who sadly passed away on February the 16th, 2024, at the age of 79. We all know that his contributions to cardiology are immeasurable. And as a community, we mourn the loss of a wonderful colleague, mentor, and to many of us, a dear friend.
I view Alain as a bit of an artist. He was an artist musician. He was an artist physician. And he was somebody who really was a creator. He really wanted to try new things. And that spirit was very powerful. And it spread to all of us who had contact with him.
I will miss him enormously. I think the world of cardiology will miss him and sometimes not even realize that they're missing him, that this is a man who selflessly gave himself to cardiology.
A humanistic physician, a great innovator, team player, and above all, a wonderful, kind human being.
Alain Cribier was born in Paris on January 25, 1945. He grew up with a passion for music and brilliantly mastered the piano, but he also had an early determination to pursue the medical profession. Inspired, among others, by the physician-musician, philosopher, and Nobel Peace Prize laureate Albert Schweitzer, whom he met in Alsace in his early youth. Alain Cribier studied medicine at the University of Paris and also obtained diplomas in law and health economics. An early interest in interventional cardiology led him to join Professor Brice Latac at the University of Rouen in 1972, where he had the opportunity to work in one of the first cardiac catheterization laboratories in France. He also spent a year with William Gans and Jeremy Swan at Cedars-Sinai Medical Center, Los Angeles. In 1985, Alain Cribier performed the world's first aortic balloon valvuloplasty. Publication of the first 3 cases in The Lancet was followed by tremendous worldwide interest in this new procedure to treat inoperable patients with aortic valve stenosis. Alain Cribier continued to innovate. Troubled by the frequent recurrence of aortic valve stenosis following balloon valvuloplasty, he systematically pursued the idea of percutaneously implanting a stented bioprosthetic valve in the aortic position. Together with co-worker Helene Elchaninov, and later, also in cooperation with interventional cardiologist Martin Leon, cardiac pathologist Renu Vimani, and others, he vigorously and consistently developed, evaluated, and refined the necessary technology over a period of more than 10 years. The years of intensive research culminated with the first transcatheter implantation of an aortic valve prosthesis by Alain Cribier and his team in Rouen on April 16, 2002. A procedure that would deeply impact interventional cardiology and dramatically change the care of patients with valvular heart disease. In the subsequent decades, Alain Cribier contributed to the further development of transcatheter aortic valve implantation and provided training for countless interventional cardiologists. By now, close to 2 million patients have been treated with the procedure that he pioneered. For his work, which extended far beyond TAVI and included other inventions, such as a reusable device for percutaneous mitral valve commissurotomy, Alain Cribier received countless awards and recognitions, including the Gold Medal of the European Society of Cardiology in 2016. Alain Cribier passed away on February 16, 2024. Survived by his wife and 2 children, he will be remembered as one of the leading cardiologists of our time. Driven by a desire to innovate, highly supportive of his team, and deeply committed to his patients. By everyone who knew him, he will also be remembered as outstandingly open-minded, friendly, warm, and humble colleague and friend.
Personally, I will extremely miss him because I was on his side for almost 40 years and it's terribly sad.
Je dirais que Sa générosité et son sourire, sa simplicité vont nous manquer, mais pour moi, il est toujours avec nous.